stressed by it, then you are affected by the stress of someone else. Yeah. And then demands of life. You see, because for us to survive, we have to do something. We have to work hard. So the demands that come with the job or everyday life will also cause some stress to your body. And then there are other things like doctor talked about students. Academia, I work in the student area, and sometimes a student comes panting and you're like, oh my God, now what is it today? When you go to the room and ask her, she says, my exams, I've not performed so well, because, we want to achieve. So the changes that we go through, the environment, sometimes it is also the personality. Some people are predisposed to stress more than others because either they call them the type A. If they do not achieve something, things are black or white. If I do not be the best in the exam, I'll still speak about students because I work in a student area. There are some children, by the person is given a course, if a person is given a course of law on government, means they performed so well. But when they come for the first time and they get a retake or they don't get an A or the best, they think now they are losers. And then they'll go into stress. So very many causes. I can go on and on, but for now, I can stop there.
Thank you, Evelyn. Dr. Joyce, would you love to add a little more there?
Maybe if we would, when you talk about causes, the issue we are discussing here is not like you are going to treat malaria. So you are going to check blood and say A causes B. So there are a number of factors that do interact, like Evelyn is saying. So some of these factors come from within the person. Other factors come from outside in the environment. Yeah? Environment, the person's environment, we are talking about the family, close environment, parents, yeah, siblings, then the school, the communities where we live. There are a number of factors. So for a child, I'll give you an example, family, for example. You can think about parents fighting, yeah? Even in church, parents fight. For children, they want to see their parents happy all the time, yeah? Peaceful. They want to see peace at home. So when you surprise them, father is beating mommy, yeah? Mommy is crying. That's enough to stress people at home. So from the family. But also we talk about the person, as Evelyn has said, our coping mechanisms. People can be exposed to the same kind of stressors. But the way we perceive that stressor, it determines, yeah, how stressful we are going to be, the way we perceive. I'll give you an example. Which example can I give? I'm thinking about an example, loss. Yeah? We face lots of losses in life. But assuming that Dr. Keith and Dr. Joyce, there have been, termination, loss of job. Yeah? You are fixed to this job. It's all your life. And all of a sudden, your employer says, Joyce and Keith, please don't come back tomorrow. You see? Keith, if he has better coping mechanisms like compared to Joyce, Keith will say, after all, I'm a doctor, I'm intelligent, I can find another job. Yeah? If Joyce has poor coping mechanisms, she will say, what? Oh my God. Maybe because yeah? I can't find another job, or I'm dead. Life is not worthy. I better die. I'm going to be ashamed. How are people going to look at this? You get it, yeah? So stress also, the extent to which you are affected depends on the way you perceive that stressor. So talking about what causes stress, there are stressors, us, the individuals, differences, but they are also, we consider the environment in which we live. Yeah, maybe.
Thank you very much, Dr. Joyce and Evelyn. From what you have spoken, I've gathered three key themes. First one is a changing environment. 2 is a threatening situation. And 3 is your coping mechanisms. Those are the 3 triggers or issues which influence the way what happens when we get stressed. Back to you, Dr. Joyce. You tend to see a lot of people at their worst. They say doctors see people at their worst and in their true sense. You could tell us more about how people present when they are stressed and come to you. I know they are physical manifestations of stress. They are mental and probably emotional. You could tell us a bit more about these physical, mental, and emotional manifestations, symptoms of stress.
All right. Talking about stress and how it causes problems in our lives, yeah? I think we need to talk about this fight or flight response to stress. Our bodies are wired in such a way that the body gets prepared when you are faced with a stressful situation, yeah? And the body prepares itself for you either to fight or to fly. By fighting, the body prepares you to get more energy, your heart is beating faster, you are breathing faster. You know, do you feel yourself, do you feel that now I'm breathing in normal situations? Do you feel it? Do you feel it when your heart is pumping harder? You don't feel it. But in terms of stress, you can even feel, yeah? You're breathing a little faster, yeah? And all organs of the body, from the brain to the toe, muscles, the skin, yeah? Every part gets affected by stress. That's why it is very important for any stressor to be identified as early as possible, and we get to know how we should avoid that. So there are the short-term effects, yeah, and then the long-term effects. So I give an example of loss of a loved one, yeah. If that loss is perceived as really bad and it affects the person in a different, you've seen people fainting at burial places, or even when something happened, you've seen, especially the young people and the ladies, yeah? They can faint, and you can see them. They can come to hospital in that fainting state. They have fainted. So you need to assess and see what could have happened, yeah? This is what we call acute, yeah, stress reaction, yeah? In that case, people need to be reassured. Yeah, no need for medicine, really. They need to rest and, you know. But then they can come when they have the longer term effects of stress. They come when they have depression. For example, now, you see, we have had people from Afghanistan. You all saw them, yeah? But have you ever imagined a situation when we are here, seated like here, and you're told, Evelyn, please, for your safety, just pass through this door, get onto the truck. We are taking you to where? Which country? Eh? You've never heard about that country? You don't have a home there? You have a home. There's nothing to take. It is only you. You get it? So stressors, some of them are really overwhelming. But not everyone is going to be stressed. Yeah? Not everyone is going to get these longer term effects. So when I talk about, there's what we call post-traumatic stress disorder. That is a disorder that is as a result of a stressor, and it will require treatment. The person perceived this as really overwhelming. They would have died. People have seen their relatives being killed, being raped. It is really overwhelming to you. And then some people present with maladaptive ways of coping with stress. Some people have resorted to drinking alcohol or using substances because, as I said, it is the way we perceive stress. For a student in school, yeah, they are like, oh, I can't sleep, I can't concentrate, I'm forgetting things. And if someone is giving me this substance to use, maybe it is calming, I'll see that as a relief. So people can present with depression, they can present with anxiety problems, a post-traumatic stress disorder, and many more. Sleep challenges is a great problem as a result of stress.
Thank you, Dr. Joyce. From what you have gathered, I see it has physical. It can come in the physical. What is mental manifests physically. You talked of fight or flight. I remembered one time I encountered thieves, and it actually came. I said, should I fight with these thieves? But they have pangas. The next action was to flight, take off. My body was reacting to the stressful situation. Of course, you feel your palms. They become wet. For some people, when they're preparing for exams, they get headaches. They cannot eat. Others, when they are having stress in the homes, they get sexual problems. There's a lot we can talk about. You spoke about anxiety. Evelyn, you could tell us a little, what is anxiety? What is this animal called anxiety?
Anxiety, and of late it is common, especially I myself, I witnessed it mostly during this lockdown and the COVID period. Anxiety is excessive fear and worry that sometimes when you read, some books will say it's irrational fear. It's like, it's fear of the unknown. You see, when someone is depressed, they are worried of the past. When someone is anxious, they are worried of tomorrow, like they do not know what is coming. So it is excessive fear, and all this excessive fear will send the wrong messages to the brain, and of course the brain will force you to act. Like the doctor is explaining, the other day, I don't know if we're in the same session, and I said I wish the doctors would be able to tell us exactly what runs in the brain, which chemical is coming. There's this adrenaline, there's cortisol, all of them are at work. There's a problem. These pupils, they dilate, someone begins sweating. But I'll tell you of something I really experienced. A friend told me during this COVID period, their anxiety, she got the full-blown anxiety, and she even went into a panic disorder in a way that she was at a pharmacy buying drugs, and then these people started speaking about the symptoms that make people, when you see yourself losing breath, and then you need to be on the oxygen. There's that period where many people are being put on oxygen. And then this pharmacist, she had gone to buy medicine for her daughter who had come from school because she wanted to prevent her from getting COVID. And then the pharmacist explained, if you hear yourself losing breath, you just know that it's COVID-19. So immediately, like the doctor asked us here that, do you feel yourself breathing right now? Honestly, I'm not. But when you're anxious, the heart will pump and you want to hold it. You feel it's getting out. So immediately she went out of control. She started saying, people, I'm losing breath. I'm losing breath. And indeed, she started losing breath. She started panicking. She fell down. She fainted. And then they got her to hospital. She had thrown her blouse off. Even the mask was off. The doctors were scared because even they were like, now if she has COVID, and then she's falling on us. So that was really a full-blown anxiety. You know, she even went into a panic. But later on, when she went and saw a doctor, they checked she had no COVID, first of all. And just knowing that she had no COVID, she started calming down. And she got fine. So anxiety can hit you at any day. There are people who fear flight, like being on a plane for the first time. Someone who these things are imagined in the brain. And now supposing we fall, fear of the unknown. So it's excessive fear.
Thank you, Evelyn. As you rightly put it, this is an overwhelming, excessive fear or worry about something. I want to delve a little deeper there. Because anxiety, when does anxiety become a disorder, Dr. Joyce? I have heard people talking, I'm having a phobia. She spoke about panic disorders. They are what are called obsessive compulsive disorders. You earlier spoke about post-traumatic stress disorders. And they are what is also, I've also heard of what they call generalized anxiety disorders. Just touch, so that people can understand the difference, so they don't say, me, I have a phobia, when they are talking about a what? Post-traumatic stress disorder. You could explain a little so that our people can understand what this a little bit means.
I don't know whether we have enough time for people to really appreciate everything, but I think we need to get focused on the stress-related disorder. So maybe for now, I can talk about post-traumatic stress disorder. As I said earlier, like it is us, the professionals, to classify these problems. I see people really suffering. Some people have labeled others as madness, you are mad. Now the person whom Evelyn has described, she was really removing her blouses. Would you say she was mad?
Not.
Yeah.
Of a panic disorder.
So the generalization, the differentiation is for us. Yeah. But it's important for the non-doctors to know that when I have this, yeah, it is a problem and I can get help. Because we are talking about these problems, depression, post-traumatic stress disorder. People don't know. They are living with these problems, but they don't know that they can get help. So talking about post-traumatic stress disorder, as I said earlier, there must be that overwhelming situation, and the person perceives it as that. Oh my God. You can imagine yourself, for example, moving in a taxi, public transport, and then you get involved in an accident, and maybe you are the only survivor. Yeah? That person perceives this, it was really overwhelming, yeah, to them. And you find that they get problems related to that stressor. They can start, for example, avoiding taxis or avoiding travel I'd rather walk. Avoiding. In that avoidance, they can avoid situations which remind them of that particular stressor or situation. Some people get re-experiencing symptoms. They can act whatever, if there was bloodshed, for example, and if there is that sight of blood, yeah, that is a clue or a cue to remind them of what happened. And they can, at that time, though it happened like 2-3 months ago or even more, it can come as if it is in the present, and they act as if that particular event is happening in the now. You get it? They may get sleep problems, frightening dreams, nightmares. You really get frightened, and you can remember what you dreamt about, and it was really very frightening. So sleep problems, lack of sleep, sleeping too little at night. They can get problems with the way they feel. They can feel really anxious, or they can feel sad, depressed. You get it? So it's a number of these problems. But before we go into the post-traumatic stress disorder, there is usually that acute stress reaction, which if managed well, people may not go into the longer term post-traumatic stress disorder. And I'm saying that they can present with depression. For a person who has depression, they feel sad in their mood. They are like you would feel when you've lost a loved one, that pain, that emotional pain. But even when they lose loved ones, they can get something which make them happy. But you can imagine a situation where you don't feel happiness at all, yeah, for a period of 2 or more weeks. Sleep changes, loss of interest in the things that you used to enjoy, yeah. You get problems with interest. You talked about for married people, you talk about loss of interest in sex, which has caused lots of domestic violence. Yeah, and when it gets worse, there is this hopelessness that people get, loss of interest in life. You feel like your life is not worth living, but people can communicate these things that we are talking about. They can communicate, I'm not sleeping, or they can be seen, yeah? But are people helping? Is there anyone to help? Maybe we need to talk about some tips to manage stress before we go into the extremes. Because we are not so many, we are few. So it means that if we manage these problems earlier, we may avoid going to hospital. And there is this issue of stigma for people who need hospital services. Like we talked about COVID, we talked about these mental health problems, which we are not going to discuss, I see in the interest of time. But sincerely, if you see your colleague, your friend having a problem, if it is depression, know that depression is treatable. These anxiety disorders we're talking about are treatable, and people are there. We should not stigmatize our colleagues. Yeah.
Thank you, Dr. Joyce. You have ably summarized these disorders that on one extreme you can start with sadness and can proceed to depressive disorders, especially if they last more than 2 weeks. On the other hand, you talked about anxiety and its symptoms and can also manifest into anxiety-related disorders, and you delve deeper into post-traumatic stress disorder. And you touched a little on how we can manage these stress-related issues. Before we go there, I would like Evelyn to tell us a little about suicide. It is an issue which is becoming maladaptive management of stress. Some people say, it's time to get out of the world because I feel I cannot manage this stress.
Okay. Yes, I will not go off from where Dr. ended and said these are all interrelated issues, because suicide does not happen from the blue. This has gone on, and the body has a way that it gives us warning signs, and someone feels they are not okay. So from not managing the stress, maybe it started by loss of a job, especially during this COVID period. Okay, let me talk about the little girl who committed suicide, because everyone heard about that. This young girl wrote a letter. Yeah, so things had been going on. Suicide is broad. Some things have come right from the family, genetic, and so on. But if we had to pick a few things, the young child was saying, this teacher, there was something to do with shaming, and as a teenager, the brain has not yet developed so well to handle overwhelming things. She may not say, okay, maybe even if I fail, I can repeat. I don't care about the teacher. She's obsessed with, why is it me? Because that's the time she's beginning to understand, to know more about, to be self-aware. So the extreme that someone takes something like, you've lost a job, and then you're like, what will my family eat? How will my wife look at me? The community, the church, all these interpretations are in one person's brain. And then this person may not even discuss with anyone. Maybe they will not come to Dr. Naluja and say, doctor, I lost my job. Because when I tell you that, you say, oh, Evelyn, you lost your job. What did you study? I'm a counselor. Okay, but you can begin in your community something. I might keep quiet and brood a lot of toxic thoughts within me until this goes on and on and on. So suicide is usually an effect of depression. In most cases, the highest percentage of people who commit suicide also have depression. So like she said, one thing leads to another. If the stress is not managed early enough, and then it goes into chronic stress until it moves into depression, loss of hope. This loss of hope of saying, I've had someone who said, why am I even living? Because we work with clients. Why am I even alive? You know, those suicidal thoughts of feeling that, why am I important? Already the brain, the body, what you feed. Interestingly, God has given us a very interesting brain. What we feed it with is what it perceives. It's not able to say, oh, now, no, stop. You'll begin thinking about that. Okay, dying. Even Keith will laugh at me because I don't have a job. Even my mother will be sick. No one will look. You collect all those things until you say, especially they say the men usually will easily complete a suicide. That's also a topic for another day. You know, women commit also have those, they attempt, but usually they may not complete. But men, because we are differently wired, because they will not go out to tell a friend that, you know, I've lost a job and so on. They
And
will complete.
they don't cry.
They do not cry. They
And
feel
they don't share.
They don't share
their problems.
all those things. So women might say, I'll die one time. But then I meet Dr. Nelja and say, you know what? I have problems. Then we begin talking. As in that talking, she will say, but even me, once you realize that I'm not alone, like this COVID has affected, because we've had a number of suicides, by the way, during this COVID. But because of perception, like she said, the way you perceive things and feel, it's, on Prime there's a topic called Luachinze. Why me? Like, it means me, I'm really, you know, so those things can lead someone to suicide.
Thank you,
And,
Evelyn. Dr. Joyce,
think-
add on and guide us how we can support
Yeah.
people with ideas of suicide.
It's very important for us to note that these problems we are talking about are treatable. And it's also very important for us to note that we should not judge others. Because, you know, these are unseen problems. If I'm depressed, it's not that I can't do anything. I'm not that very weak, yeah? There are things that I can do. But in most cases, you find people saying, but Joyce did this thing well. How come she's doing the other thing the other way? So it's very important for us to understand, appreciate that these are treatable disorders. Without treatment, yeah, people can, like for example, you're talking about depression. It starts as mild, then it goes to moderate, then it goes to severe forms. And in the severe cases, people can actually kill themselves, or they can harm others. If it affects a mother, and Evelyn has talked about the negative thinking, yeah? When we are depressed, the way we think is in the negative, yeah? And that is affecting the way we feel, is affecting the way we are thinking, and this is affecting the way we are behaving. So if I'm sad, I'm depressed, this depression is not just the sadness we feel when, you know, which lasts for a few minutes and it goes away. This is persistent sadness, which is not going away. For a period of 2 or more weeks, you are going to bed, you cannot sleep at night. You have those thoughts which are really traumatizing you. You are thinking in the negative. So when a person is depressed and we are seeing them earlier, we can help them before and prevent suicide. You talked about maladaptive ways of, like suicide being a maladaptive way of coping. To some extent, maybe not, because this is a problem which needs help, yeah? It needs help. And it is not like nekozesa. It is true, that's the way it's the reality for me, though it is not the reality for you. So we should look at these problems and we should not be judgmental. We should look at ways of helping our colleagues. Like if a colleague opened to you, Dr. Keith, that, you know, I think life is not worth living. I think I'm losing it all. And you don't do anything. And then the following day you find me when I'm gone. You're like, oh my God, I wish I had acted. So what I was talking about is that if depression affects a mother, for example, they already have this negative thinking. They're thinking life is difficult, everything is difficult, it is a problem, my children are suffering. So if I think about killing myself, how about these children? Are they going to stay in this world suffering? Yeah? I start with them. Yeah? Yes. So many people laugh at that situation when actually it is very serious. Yeah? It is a treatable condition, so we need to get there. So when we talk about tips to manage stress, yeah? Before we go into there, you said there's a time, like Dr. Keith said, I felt like, should I fight? Eh? You're fighting because this adrenaline is, preparing your body to fight. So when you are in such a situation, please get away. Get away from that situation. While you are away, try something like breathing exercises. You try to breathe in deeply, deep breathing. It helps in the like relaxation techniques. You take a deep breath. You get away from the stressor. Please get a network. Get at least some friend you trust to share, to open up. Open up to someone that you know this problem. Manage time. Don't put too many things. Be real. Yeah? Don't compete with anyone. You are never equal with anybody. Don't compete, please. Yeah? Be yourself. Take real challenges, real. And if the problem needs surgery, for example, go for it. Yeah? And most importantly, now, I think, before I forget, trust in God. By trusting in God, you put, there are people keeping that anger. Yeah? If you don't forgive, you are the ones who are being hurt. So forgive, pray, trust in God.
Thank you, Dr. Joyce. Connie, you could quickly, in 1 minute, summarize your tips for managing stress.
Surely Dr. has already said most of them, but I would also want to say, from the psychological point of view, we know ourselves. Self-awareness is very key. If I know that if I join a certain conversation, politics will not work for me, it's going to raise my tension, please do not join. Okay? And the body, like we said, gives you signs. When you get constant headaches, you're not sick, you begin to find out what is worrying me. Could it be job related? Could it be about the marriage? Could it be about children? Give it a name. Don't just say, I'm stressed. Find out what is exactly stressing you. And then also it's good to get rid of the old hurts. If something hurt you in the past and you've not worked upon it, in most cases when you meet a similar situation, you're going to keep reacting. Why? Because you're holding on. That's why they have talked about forgiveness. You're holding on to past hurt because I usually tell clients that you cannot give what you do not have. Hurting people hurt others. So when you're stressed, you remember you're going to hurt your family. So always make sure, know what is stressing you and get support, especially from your support systems. Thank you so much.
Thank you, Evelyn and Dr. Joyce. I cannot put it any better. The experts have stated it. All we want to say is that if you have a challenge, trust God, pray about it, consult, get a support system, prioritize your time, and prepare. You'll be able to get through it with God's help. May God bless you, and thank you for listening. Thank you, Evelyn, and thank you, Dr. Joyce. Have a good afternoon.
Thank you so much. Thank you so much for such a wonderful, wonderful discussion. I have learned how I need to manage when I am stressed. And we've learned that, stress is part of life. At times you cannot do without it, but you can surely, deal with it the best way possible for you not to get into depression, for you not to get into suicide thoughts, and for the matter to get out of hands. Our doctors and our psychologists Thank you so much for this. I have learned, and I believe that the person watching us right now or listening to us on Prime Radio has also been able to learn something. At this particular moment, I do not want to do a lot of talking because we have so much for you, as we already read for you earlier in the day. The program is fully packed and beautifully packed just for you. We have the Herald's Choir, do not forget that, and we are going to be having them a few minutes from now before we get into our divine service. I hope you are set for that as well. My name is Joan Comfort Agazu, and thank you so much for being part of the CUC 2021 camp meeting right here at Chirika Hill. God bless you.